Understanding the distinctions between anorexia nervosa and bulimia nervosa is crucial as you prepare for your licensing exam. While both are eating disorders that may present with overlapping symptoms, their underlying characteristics and treatment approaches differ significantly. Being able to accurately identify each condition not only demonstrates your clinical competence, but also ensures you can provide appropriate care in real-world scenarios. Quick and confident recognition of these differences is often tested, making it an essential skill for exam success. By mastering this knowledge, you'll be better equipped to navigate both the exam and your future practice. Let's take a closer look at the DSM criteria for anorexia nervosa, emphasizing the essentials for exam success. Unlike some other disorders, there is no minimum duration required for diagnosis. Anorexia nervosa is divided into two subtypes, the restricting type and the binge-eating/purging type. Severity is determined by BMI, with specific thresholds indicating mild, moderate, severe, or extreme cases. It's important to understand what is meant by significantly low weight, which is typically defined as a weight that is less than minimally normal or expected for age and height. Clients may present with noticeable weight loss, intense fear of gaining weight, and a distorted perception of their own body size. Keeping these criteria clear will help you accurately identify and differentiate cases in both clinical practice and exam scenarios. Bulimia nervosa is characterized by recurrent episodes of binge eating, followed by inappropriate compensatory behaviors such as self-induced vomiting, excessive exercise, or misuse of laxatives. According to the DSM criteria, these behaviors must occur, on average, at least once a week for 3 months to meet the diagnostic threshold. This frequency and duration requirement distinguishes bulimia nervosa from occasional overeating, which lacks both the regularity and the compensatory actions. Unlike simple overeating, individuals with bulimia experience a sense of loss of control during binges and are driven by an intense preoccupation with body shape and weight. The presence of these compensatory behaviors is essential for diagnosis, setting bulimia apart from other eating patterns. Understanding these criteria helps clarify why bulimia nervosa is considered a distinct clinical disorder. Both anorexia nervosa and bulimia nervosa share significant similarities that impact individuals' lives. One of the main commonalities is a distorted perception of body image, which can drive unhealthy behaviors and thoughts. People struggling with these disorders often experience intense feelings of shame and may go to great lengths to hide their symptoms from others. Mood swings and emotional instability are also frequently observed, making it challenging for individuals to maintain healthy relationships and daily routines. As a therapist, recognizing these patterns is crucial for effective intervention and support. Understanding these shared traits can help guide your approach and foster a more empathetic connection with your clients. Now, let's explore the key differences between anorexia and bulimia. Typically, individuals with anorexia are noticeably underweight, whereas those with bulimia may have a weight that falls within the normal range. The main distinction lies in how each condition manages weight. Anorexia is characterized by severe restriction of food intake, while bulimia involves cycles of binge eating followed by purging. Recognizing these patterns is essential for accurate identification. Being able to distinguish between these behaviors in real-life situations is crucial for effective support and intervention. Let's look at Sarah, a college student whose experience highlights the realities of anorexia nervosa. Sarah maintains an extremely low body weight, carefully restricts her food intake, and follows strict eating routines. She expresses a persistent fear of gaining weight, even when others reassure her about her appearance. Despite clear signs of declining health, Sarah denies that anything is wrong. These symptoms often surface in daily life: skipping meals, avoiding social events involving food, and obsessively counting calories. Recognizing these warning signs early is crucial, as timely intervention can greatly improve outcomes and support recovery. Sarah's case is a clear example of anorexia nervosa rather than bulimia nervosa. She does not engage in binge-purge cycles, which are a hallmark of bulimia. Instead, her behaviors center around strict food restriction and excessive exercise, both of which contribute to her significantly low body weight. These characteristics align closely with the diagnostic criteria for anorexia nervosa. It's important to focus on these distinctions, as they are key details to remember for the exam. Understanding the differences between these disorders will help you accurately identify and differentiate cases in clinical scenarios. Now, let's meet Michael, a client living with bulimia nervosa. Michael's experience highlights the characteristic binge-purge cycle, where episodes of overeating are followed by compensatory behaviors such as purging. Despite maintaining a normal weight, Michael struggles with intense feelings of secrecy and shame surrounding his eating habits. These emotions often lead him to hide his behaviors from friends and family, creating barriers in his relationships. The impact of bulimia extends beyond physical health, affecting Michael's daily routines, social interactions, and overall well-being. His story offers insight into the complex challenges faced by individuals with this disorder. Michael's case is best classified as bulimia nervosa rather than anorexia nervosa. The distinguishing features include his frequent episodes of binge eating, followed by compensatory behaviors, such as purging. Importantly, his body weight remains within the normal range, which is not typical for anorexia nervosa, where significant weight loss is a core symptom. Additionally, Michael is aware that his eating habits are out of control, a common characteristic in bulimia nervosa. These key differences are essential to recognize for your exam, as they help differentiate between the two disorders.